Welcome to our spinal health class. In the next 20 minutes, we're going to give you what's taken me 35 years to learn. I believe the information we're about to share will change your life. So sit back, relax, and prepare to be amazed. First thing we'll start with is a couple of questions. I want you to picture yourself in a park having a picnic with your sweetie, going for a little walk, and all of a sudden you realize, something's up with my tummy. And before you know it, you're over in the bushes vomiting. At that moment, are you sick or are you healthy? Well, if you're vomiting because the potato salad was left out, it was warm, now you've got food poisoning, that's a totally healthy response. Your body is literally trying to get toxins out, and if you don't get those toxins out, you could die. So, vomiting could be healthy. I often hear, "Doc, it hurts right here. I think I have a pinched nerve." What you have to realize is only 30% of that nervous system is sensory and capable of causing pain. 2/3 of your nervous system is running your body. So for instance, what do you think would happen if you cut the nerve that went from your brain to your heart? Well, you die. What if instead of cutting that nerve, say we pinch that nerve? Do you think you'd be healthier or sicker? I'm going to tell you you'd be sicker every time. You see, true health is a state in which every organ in your body is functioning 100%, not just the absence of symptoms. Symptoms are your body's way of telling you that something is wrong, and unfortunately, they often don't show up until the problem's pretty bad. Now, you always have the chance to cover those symptoms up with drugs, but they won't work forever, and they do nothing to correct the cause of the problem. At Barton Chiropractic, we are committed to getting you well and getting to the cause of that problem. I'm reminded of an old-time chiropractor that once told me, a short pencil is always better than a long memory. So grab your pencil, grab your notebook, take some notes, and I hope you learn a ton.
Hi everybody, I'm Dr. Jake Barton and this is Dominique. Today we're going to be going through the stretching portion of your spinal care class. All the stretches today are designed to be fairly simple and straightforward. If you have questions after this, normally if you were in person, we'd say ask the questions, but since this is on a video, just bring them to your next appointment. We'd be happy to help. So the overarching theme for all these stretches is they're going to be held very gently. You should feel a nice stretch, like a therapeutic stretch, but nothing should hurt. And all of them, except for the wall angel and the neck stretches, will be held for 2 minutes on each side. We'll go a little more in depth with that in just a minute. So get your notes out, get ready, here we go. So what we're gonna start with are the neck stretches. What we're gonna have Dominique do is she's gonna, and I'm gonna explain as Dom's doing the exercises, she's just gonna tip the head nice and easy to the side. She's gonna count to 5 seconds. And then she's going to give a gentle little tug at the top. Beautiful. And she's going to hold that for another 5 seconds, making sure that the shoulder stays level with the floor. After that, she's going to the other side. Beautiful. Then she's going to hold that there, and then she's going to give it a nice little tug for another 5 seconds. After she finishes those 2 parts, she's going to tip her head forward and to the right, just gently. Beautiful. Hold for 5 seconds, and she's going to give that a little tug. She's going to also, after that, do the other side, hold for 5 seconds, and then give it a nice little tug for 5 more seconds. That circuit, if you do it twice, is 1 minute and 40 seconds, and we've got 20 seconds to round it up for 2 minutes with the next exercise.
We have one more exercise for you to do, and that's going to be the exercise for your neck to help build the curves back in here, okay? It's actually called cervical retractions. We call them chicken necks. Just picture a chicken, it's real simple. So you're going to keep your shoulders straight. We're going to take and bring that chin back in this way, kick it back forward, back again forward. See, just like that rooster walking around there, you got it, okay?
The next stretch is called wall angels, and we're going to make wall angels. This is for the upper back as well as the shoulders, okay? So what we're going to do is we're going to find a flat surface like a wall, and Dom's going to back up to it, okay? I'm going to swap spots with you. What Dom's going to do is she's having her heels, she's having her low back, she's having her shoulders, she's having her head touching the wall. Probably scoot just a hair to your left, Dom. There you go. She's gonna put her hands up, like she's getting ready to make a snow angel, like a wall angel. And she's gonna move them from there all the way up, keeping everything touching the wall. It's maybe a little bit difficult for some of us mere mortals. If you're doing this stretch and it's a little bit uncomfortable, make sure she's gonna try to keep that at 90. If this is a little bit uncomfortable, you find a spot that's like, ooh, that's a good stretch, okay? Pause there, stretch, that's what it's for, you know? You can hold that, you know, maybe 20 seconds, just feel that nice, good stretch, and then find that spot where it needs it, okay? And you will, in time, be able to work up to doing what Dominique's doing. So the next set of stretches we're gonna do is for the lower back. We're gonna be using a chair for all of these stretches. The chair height is somewhat important. We want it to be just below the kneecap, okay? So what Dominique's gonna do first is she's gonna start stretching the back of the legs or the hamstrings. She's gonna put one leg up on the chair, beautiful, and just hold just like that. Notice that Dominique's spine is nice and tall. She's not leaning forward, she's not twisting, she's just letting that stretch the back of the leg. If you're flexible and you don't feel a stretch here, what she can do is she can tip forward slightly. Notice how her spine's still nice and tall. If she again doesn't feel a stretch there, she can come back out of that. And she can pull the toes back towards the body, and then you'll feel it a little more in the calf and a little more in the hamstrings too, so that's a good stretch. She's gonna hold this stretch for 2 minutes on each side. Set a timer, that's a long time, so set a timer, all right? That's really as simple as the hamstrings are. The next part of the stretches we're gonna do are for the quadriceps and the hip flexors. What Dom's gonna do is she's gonna put one knee on this chair, she's gonna step the other leg in front, going into like a lunge position. She's gonna keep the spine nice and tall, and she's gonna feel that in the front of the hip, okay? She's gonna hold this stretch for 2 minutes. That's a long time. Again, set a timer. She's gonna do both sides. If that looked like a little bit much, either for a knee injury or something like that, not feeling stable, there's a lot of other ways to get into this stretch. She can walk to the side of the chair, put one knee up, and then she's right in the middle of that stretch. Another thing she could do is maybe just walk to the front of the chair, put one knee on the chair, and then there you go. She's right in the stretch there. What we don't want to see is the funky chicken balance test. Okay? That is not how you stretch your quads. That's how we're stretching the quads, okay?
A lot of people ask, what should I be doing for exercise? And right across the board, I can tell you for everybody, the absolute best exercise is going to be walking. Preferably not on a treadmill, outside, breathing air, fresh air, getting some sunlight. Grab your sweetie, grab a smile, go out, relax, see the world. At this point, we really don't want you doing anything more than that. As we go through your care, the doctors will have specific exercise recommendations for you, but at this point, just stick with the walking.
As a reminder, and as someone that has scoliosis, it is super important that you keep up on your chiropractic adjustments as well as do your stretches every day. It's 10 minutes every single day, and you will see my face as soon as you walk into the store, and I will make sure that you are doing them as well. So don't let me down.
One of the most important things is sleep and sleep posture. And the reason it's so important is if you're spending 8 hours a day sleeping, that's basically a third of your day. And by the time you're 30, that's 10 years you've spent in any one given position. So we are going to spend a little bit of time on this. First of all, some of the stuff that we talk about now is going to be dependent on the type of mattress you have. I'm going to recommend a firm mattress. Probably the biggest secret with any mattress is to take a look at it without the covers on it. Make sure that thing's flat. If you're going to look at that mattress and there's a divot in it, you need to either flip it or get a new one. It's already broken down, you're not going to get the support out of it, okay? You want something that's going to be a little bit firmer than what you're naturally comfortable with, okay? Dom, if you would lay down on your back, this is the #1 way we're going to have you guys sleeping, okay? Now, Dawn doesn't need much of a pillow, realistically, because what we're going to look for here is look at her neck and her spine. We're going to want all of this straight. So preferably something that's going to support this area here. Go ahead, put your head there. And you'll notice this creates a problem, right? Now we have nothing supporting here. We've got that big arch in there. So what we'll do with that is get you to lift your legs a little bit, put a pillow underneath there. Now that flattens out this spine and all of that gets supported. The more cushion we have back here, the larger pillow you're going to need here. So have somebody check you out from the side when you're sleeping on your particular mattress. and you want all of this to be straight. That is the number one way. The second best way is going to be with you on your side. You see she grabbed the pillow and put it between her knees. Smart girl, she knows this trick, okay? What that's gonna do is it's gonna take the pelvis off the inside of that, take the stress off the inside of the pelvis there, right? The next thing has to do with the size of the pillow here. And this is where we get in trouble with people that flip-flop. Dom doesn't have massive shoulders like some of you guys do, but the larger your shoulders are, the bigger the pillow needs to be here. Dom, would you go ahead and flip over and face the wall, please? So you'll notice, if we're looking here, okay, we can draw a straight line right through here and right through her neck. If this pillow was too large, it would go like this, or if it wasn't big enough, it'd go like this. And then we'd end up waking up with our neck sore in the morning. Now, the problem with sleeping on your side is, most patients don't sleep like this with everything straight. Most patients sleep like, there you go. That's how most people sleep on their side. And you can imagine if you sit all twisted up like that for 8 hours, what's it gonna feel like? So, as we get up in the morning and you start to go out through your day, there's a couple of things we need to pay attention to. And number one is just your first initial stretches. I always like to have everybody stretch. Just take your hands, put them over your head, point your toes, just kind of stretch a little bit that second before you get out of bed. The next thing is, once you get over and you head over to the sink, we're gonna have Dom run through this with you, okay? So pretend there's a sink right here. As you go to brush your teeth and go to put your makeup on and do all that other girly stuff, right? There's a couple of things you can do to actually help that, okay? Number one, we want to get you closer to the sink so you're not bending over like this. So the easiest thing to do is to just kind of, there you go, spread your legs a little bit, and it literally lowers your whole center of gravity, right? The next thing you can do is go into a lunge position, like that, leaning forward, okay? Or the other one would be to bend both knees. And keeping in mind, whenever you do bend forward, that we want you to bend here. Go ahead and stand up a little bit. Bend here, so come forward, there you go. As opposed to bending over like that. Okay, and that should be good. Now we'll move into driving a little bit. So, when you're driving, a couple of things, it's like any seated posture, right? We're gonna wanna make sure there's a 90-degree angle here. And this should all be in your booklet, so I just wanna run through it real quick. You want a 90-degree angle here, same thing in your car. What we don't wanna see is you sitting back like this, like you're in some low rider cruising, right? Hand out the wheel, looking all cold. No, that's not what we want. That creates problems here, creates problems here. Okay, both your neck and your low back. So don't do that. Make some more work for us. It's all that. Okay. You get to work. Assuming you're back in the office by now, you get to work, and we start thinking about computer stuff. If you're at a desk and you're working on a computer, it's important that computer is at eye level or a little bit above eye level. Your monitor is, that is, okay? And we want that in front of you. If that monitor is over here to the side, she's gonna be looking, and you're gonna be looking off to the side for a prolonged period of time, and it will literally create problems in your neck. So try not to do that. Try and put it in front of you and elevate that a little bit.
A 4-year-old, a 40-year-old, and an 80-year-old all fall down, skin their knees, right? Who heals first? Well, the 4-year-old heals first, of course. They've got, higher vibration, faster metabolism, their body just heals faster, period. Who heals second? 40-year-old. Who heals last or heals at all is grandma. Okay, this is why it's not, it's definitely important that you get checked and you see a chiropractor, but this is why it's so important that those other two do as well. Grandma being an at-risk population, her body's gonna need probably a little bit more help healing. What about your babies? What about those babies? What about all the times they fall down when they're learning to walk? What about all the times they bump their head or bump something as they're going through life, Another thing is, you walk around when you're in the office and you'll see kids playing around, you'll see pictures of babies on the walls, and you go, geez, pop kids' necks? Or do all these kids have bad backs? No and no. If you ever watch a child receive an adjustment, if they need to even get adjusted, it's a very, very, very gentle, specific adjustment. And then you ask, well, why? Have you ever watched delivery process? Without getting too graphic, I just had, or I didn't have, me and my wife had, our baby this year. And that was probably, not even probably, that was the coolest thing. Most incredible, empowering thing I've ever had happen in my entire life was this little man being born. But goodness gracious, is it violent. You know, you watch this poor little dude's head, you know, slamming down into the cervix, and you know, going to chiropractic college and anatomy, and it's like, it's very different when it's in a book or on a video, where it's like, that's my wife. As this little man's head's just pounding on the cervix, you know, on average for a first labor is what, somewhere between 17 and then 26 hours in labor of mush, mush, mush. And then you wonder, as that baby starts to crown and the head comes out, and it's like, is there a pot? And then your midwife or your OB or whoever hands the baby to you and goes, be careful of the soft spot. You're like, careful of the soft spot? This poor dude's little neck's just been cranked on for the last how many hours, you know? Is it a possibility that that's when a child got their first subluxation? Is that a possibility when you got your first subluxation? Might be, you know? When it comes to small children, you know, I remember with our baby individually, he's born gorgeous, big old lump on the back of his noggin, and his eyes look like this, got converging nystagmus, you know? And our midwife looked at me, and I'm just a normal dude here, you know, this is scary stuff. And she goes, hey, you might want to take your baby to a chiropractor. And I'm like, hey, I know a guy. Within a week, he had to get adjusted twice, got checked, didn't have to get adjusted the next time, he got adjusted the next time. His eyes went from being completely crossed to uncrossed. Beautiful, gorgeous, no head crank to the side. So if you have a baby that's having an issue, or you have a friend who's having a baby who's having an issue, can chiropractic cure everything? Chiropractic couldn't cure ham. Your body's going to cure it if it's going to. But is there a possibility chiropractic could help? I don't know. Let's get them checked. That's just what I say. Let's get them checked. Let's see if we can help.
The next facet of health is nutrition. And nutrition is very basic, and that's the way we'd like you to eat. Simple foods in moderation. Things that you can pronounce. If you're looking at a package and it has this big long chemical name and you have no idea what that means or what it says or even how to say it, best not to even eat it. Okay? Broccoli, we know what that is. Spinach, you know what that is. Meat, chicken, fish, all that stuff. Simple, organic foods preferably, and you'll be set. You have to remember, your body is trying to heal. The way it heals is by regenerating new tissue cells. Those new tissue cells are going to be made out of whatever you're eating. So if you're eating junk and Wendy's and McDonald's and just all fast food stuff every day, don't be surprised when your body doesn't respond quite the way you like it to. The next thing is water. You should be consuming half your body weight in ounces. So Dom, that weighs 110 pounds, you're looking at about 55 ounces of water a day. Okay? So break that down for yourself, figure out what it is. That's what your body needs to be hydrated and to function properly. So we've covered stretching, we've covered exercises, we've covered a little bit about diet and nutrition. And the last and probably most important part is the nervous system. This part is so important. We've actually brought in a guest speaker to handle this. You're gonna love them.
So what's the big idea? Well, the big idea is your central nervous system. Your central nervous system is made up of your brain and spinal cord and is continually monitoring and coordinating every single function in your body.
If you think of the brain as a central computer that controls and coordinates all the functions of your body, then the nervous system is like a communication network that relays messages back and forth from the brain to different parts of the body via the spinal cord. The spinal cord is a long bundle of nerve tissue which extends from the lower part of your brain down through your spinal column. Along the way, smaller braids branch off from the cord and pass out from the spine between each of the movable vertebrae. These braids divide again and again into tiny nerve fibers and fill the entire body, going to each cell, organ, and tissue. Every human has an estimated 15 billion nerve cells, sending and receiving messages through the spinal cord.
Now, our nervous system is extremely delicate. So what protects it? Our spine.
This is what a normal healthy spine looks like. It has 24 movable vertebrae, each working with the one above and below it. A disc separates the vertebrae and acts like a shock absorber and a spacer for the nerve. So why is a healthy spine so important? Well, it protects the spinal cord and the delicate nerve tissue and allows us to bend, flex, twist, and move freely without compromising the nerves.
If the spine is not moving freely, it's referred to as a vertebral subluxation complex, or for short, a subluxation. Is that right? Subluxation. Is there another word we can use for that? No? Okay. This is when two or more vertebrae have lost their normal motion and/or position. This can cause interruption to the normal nerve flow and interfere with the communication from the brain to the body and from the body back to the brain. Research at the University of Colorado found that it only took between 8 to 10 millimeters of mercury pressure to reduce the nerve supply by up to 60%. That's about the weight of a small coin. Compression can exist without pain, so that means where the nerve goes to can be robbed of up to 60% of its nerve supply and you may not even feel it. This is what is referred to as a silent subluxation. So what happens when you have a subluxation? That area can start to degenerate in as little as 2 weeks. This degeneration causes scar tissue to develop, which leads to more scar tissue. This degenerative process can continue as long as the immobilization is present, and this type of degeneration is preventable. Spinal degeneration has nothing to do with how old you are. You can be 60 years old and have a perfectly healthy spine, or you can be 10 and have a spine that's already showing signs of degeneration. It all depends on how and when the subluxation occurred. If the nerve supply to anywhere in the body is disturbed, it can eventually lead to a symptom. Symptoms are the only way for your body to let you know that something's wrong. So let's go back to the same spine again.
If you have nerve interference in the cervical spine, it can lead to headaches, migraines, lowered immune system, sinus troubles, hay fever, abnormal sleep patterns, eczema, hearing loss, tonsillitis, chronic cough, croup, pins and needles into the arms and hands. In the thoracic spine, asthma, functional heart problems, bronchitis, influenza, gallbladder troubles, liver conditions, blood pressure problems, indigestion, heartburn, gastritis, lowered immunity, allergies, kidney troubles, chronic tiredness. In the lower back, constipation, menstrual problems, bedwetting, knee problems, sciatica, backache, poor circulation, swollen ankles, weakness into legs and cramping. Wow, I'm out of breath. And that's naming only a few.
Did you know that less than 10% of your nervous system perceives pain? So quite often, by the time pain and symptoms appear, the nerve interference could have been present for months or even years. Think about when a person has a heart attack or a stroke. They don't actually feel the arteries blocking up and usually don't know anything's wrong until it's too late. Painkillers and anti-inflammatories can cover up the symptoms, but they don't get to the cause of the problem. By masking these symptoms, it allows the problem to continue to develop silently until there's a major health crisis. We all know about the damaging side effects that can occur from long-term drug use. So why continue filling your body with drugs to hide the cause of the problem? Now you might be wondering what causes subluxations to occur. Gardening, sports, computer work, pregnancy, improper lifting, arguments, food additives, chemicals, birth, poor posture, to name but a few. There can also be mental causes, such as stress. The average 5-year-old has had approximately 2,000 falls, of which 200 are considered serious. But usually an isolated event alone is not to blame. It's an accumulation of many of life's little incidents and accidents. Recent research has found that in births that required intervention by a doctor, which means they used forceps, suction or excessive force, 95% had upper neck injuries. So it's a smart decision to have your child assessed at an early age. So the chiropractor's job is to locate and correct spinal interference so your nervous system can perform at its own optimal level. Remember, the immobilized area will degenerate at a faster rate than the area with good balance and movement. Fortunately, with the right care and by mobilizing these areas and creating good alignment, the body can begin to slow, stabilize, or reverse the degenerative process. Chiropractors assist the healing process by re-establishing the nerve flow to its optimum level. This allows the proper communication between the brain and the body. Chiropractors don't treat the symptoms. Rather, they remove the nerve interference, which allows the body to do what it does best, heal itself. When you get a cut or a broken bone, who heals it? Your body does. All forms of the healing arts have their place, and let's face it, medicine has an important role to play in crisis and emergency care, and in these situations can be life-saving. On the other hand, chiropractic is vital in keeping your body functioning at its best possible level by removing nerve interference and allowing the body to heal itself. So for health, wellness, and quality of life, chiropractic is the smart choice for you and your family.
Wow, I got to give a shout out to the team. I think they've done an amazing job getting you guys this information. You know, all of this started actually way back in 1979. I know that's a long time ago, before probably a lot of you were even born. I was on my way to see my sweetie, lived out in Bethel Island, was heading over to Discovery Bay. I was stopped on Bixler. Car came around from Highway 4 and fell asleep while I was driving, and basically T-boned me right into the driver's side of the car, right? And I looked up and luckily saw him coming, and was able to jump over to the other side of the vehicle, at least part way, as that truck continued to push and drive right into my car and literally drove the door right into the center console of the vehicle, pinning my legs. I came to with the ambulances, the jaws of life, and those guys trying to dig me out of the car. And the rest of that story is a bit of a blur for a while. The next step of my life, I was on disability, wasn't able to work. I really didn't know what I was going to do. They were talking back surgery, and I knew that really wasn't what I wanted. Enter my hero, right? My little grandmother, probably all of this tall, and she was persistent. I'll tell you, short little Italian girl, she was persistent. David, you got to have my chiropractor check you. I was like, no, I'm not going to your chiropractor. No, I'm not going to do it. And David, you got to have him check you. You got to have him check you. No, I'm not going to do it. And she kept calling and talking to me. And this was months. Okay, it took a while. I was a little stubborn. And one day she shows up and wants to go to lunch. And I thought, okay, fine, we'll go to lunch. Sounds good. And we get in the car and we drive away. And my grandfather's driving. And we drove from Bethel Island out to Concord. And I thought, she's making me lunch. This is awesome, right? Well, she didn't make me lunch. What she literally did was took me to her chiropractor. And I was a bit surprised and reluctant, but I went. And literally the next thing you know, I don't even know how it happened. God picked me up and set me in chiropractic college. And here we are, right? 35 years later, it was all a total blessing, and I believe He uses things in our life that we think are trauma, that we think are bad, and God uses them for good. And this was one of those instances, and that's why I always think, man, my grandma's just my hero. I mean, she literally saved my life. I'm sure when she was persistently encouraging me to get checked by a chiropractor, she had no idea how it changed my life forever. You never know how far-reaching something you think, say, or do today will affect the lives of millions tomorrow. I believe God gave me this gift to be able to help sick and suffering mankind, and it's my responsibility to use this to help as many people as I possibly can. So, what I want to do is for the next 10 days, I'd like to invite your entire family, as well as any and all of your friends, into the office to get their spines checked. Normally, consultation with one of our doctors, examination is $95. A set of full spine weight-bearing digital x-rays are $400. But for everyone that you refer, It schedules an appointment within the next 10 days. We're going to do that for absolutely free. Okay, it's just our way of saying thank you. So, if this is making sense to you, I want you to write down everyone you can think of that has not had their spine checked and give that list to Taylor or Dom. Then I want you to contact them and let them know how much you care. You know, you could even share this video with a loved one. Thinking about heroes, I'm reminded of a story of an old man that was walking down the beach. And he's bending down, he's picking up these starfish, because there's hundreds of them. The whole beach is covered in starfish. And he's bending down, picking them up and throwing them back in the water. Bending down, picking them, throwing them in the water. And he's putting a dent in it, but not much of a dent, right? And as he's moving down the beach, he goes by this young kid that's running down the beach. And the guy goes, "What are you doing?" And he goes, "I'm throwing the starfish back in the water, trying to save these things." And he goes, "Oh man, it's not going to make any difference." He goes, "What do you hope to accomplish? There's thousands of them." And he goes, "For this one, it'll make all the difference in the world." And it just reminds me of the people in our lives. How much of a difference it makes when we just tell one more person, when we just save one more person. Maybe minimize the suffering in just one more person. And that's why I'm counting on you. I'm counting on you to tell your friends, to share this video, to help as many people as we can in our lives, because there's way too much suffering in this world. And I feel like we have the answer, like we can help. So please, tell your friends, share this with your